So the first question I guess I have for the panel, as I'm sure these guys are curious about as well, we understand that the Affordable Care Act has impacted a lot of different areas of healthcare. I think one thing in particular we're curious about is how does that impact, or how does that relate to mental health? Since I know a lot of these guys primarily focus on mental health issues.
The Affordable Care Act impacts mental health in reference to, as a part of the Affordable Care Act, mental health as well as substance abuse is one of the 10 essential services that have to be provided. So therefore, people that sign up with the Affordable Care Act will be offered services through mental health and substance abuse with their new insurance provider.
Now the law says you have to include us in certain plans too. So that's two ways it's going to improve access.
The Affordable Care Act right now, you have to realize this is thing in progression right now. So right now we're starting off at a point where mental health still doesn't have as strong a benefit as it should on a lot of policies, especially people that are on bronze policies or people that are going to fall under the gap because Georgia didn't expand its Medicaid. Right now I think there's about, 233,000 people they're saying right now in the state of Georgia right now that are probably going to get left out in the cold, that don't qualify for Medicaid and don't have the financial resources to still be able to take on the plan. So a lot of these people that are qualifying for plans or qualifying for the bronze plan, a lot of the coverage is still going to be beyond their reach because they have depression screening. But if they need anything other than a primary counseling visit, it's going to be completely deductible Pearson for them. So, like I said, that leaves a lot of people staying in the same situation where they are now, but they're just not seeking out coverage because they can't afford it.
My question to the panel would be, what changes do you foresee or have you seen in mental health care since the act is now in place? And can you comment on the mental health care look, what it looks like pre-cost, pre-ACA?
I think the one thing that is important, before the Affordable Care Act, mental health was a side issue, but now it's going to have to be integrated within all of health. So you can't separate like the mind and the body the way you could before the act. Now it's going to be, now mental health is included in every part of the healthcare the system. So therefore, we're not going to separate like the mind from the body.
And I would have to agree with that. It forces people to take a holistic approach when working with a person, where you're not just looking at the body, but you're also looking at the mind as well.
In regards to the Affordable Care Act, key components that you think would be important to mental health professionals, if there are any key components?
Prescription drug coverage.
Really?
Access.
And you can't discriminate because of pre-existing conditions. A lot of people have mental illnesses early on in life.
Right.
So if you want coverage, you cannot be discriminated against them. You can still get coverage. And that has been an issue in the past.
Oh, okay.
One of the things that we have is we still have a situation right now where almost 99% of all small businesses or large businesses went ahead and took a option to stay on a grandfathered plan. They took a mitigated rate offer, which means that they went ahead and they changed their renewal to a December 1st effective date. So for most people right now that are insured in the state of Georgia or that are on an existing individual health insurance policy until it renews and has to meet the ACA requirements, they are in a plan right now that is virtually no access to mental health. Because again, most of these policies, until they meet their deductible, they don't even have a primary care counseling coverage. Okay, so a lot of people are still going to be left out in the cold until we hit December 2014.
So now, I can understand with the Affordable Care Act, as the young lady said, where it was a side issue before, kind of sort of like dental, it's something separate. Now it's just all under the guise of health. mental health, whatever it is. So now if I have to go to my therapist, that's going to be covered under this program. It's not something that's separate anymore.
Correct.
Okay. What should mental health professionals do to educate themselves on the act?
I'll answer that. On Tuesday this week, I actually had to sit down with the navigator and sign up like for myself. And the process was not what we've heard about in the news.
Right.
The website didn't crash. There was nobody asking me about a lot of personal information. It took about an hour. And I qualify for a plan that costs about $209 like a month. With that plan, there is a $6,500 like deductible. That is only for catastrophic issues. All your preventive stuff is included free of charge. So the best way to get educated is to go through this, go through the process and see that it's not as bad as you've been told. And the other thing that we can do is, a couple of months ago, I went to a workshop with Dr. David Satcher over at the Carter Center. And all those professionals said this is a better plan than what we have now. So we all have to maybe get rid of some of our beliefs politically and at least start rowing the boat in one direction and see how this works like for a while. So me personally, I sat down like a navigator, went through the process, and realized the website doesn't crash. It takes about an hour, and it's really simple.
I think just for clarity, I think a lot of people believed, as I did at one time, that with the ACA, that Medicaid and services like those were going away. So this is in addition to Medicaid. For those that earn under a certain amount, they still will be covered under Medicaid, and the ACA will kick in for those over a certain amount of the poverty level. Is that correct?
$15,302.
$50,000 earned for individual, or
If you make below $15,302 as an individual, you qualify for Medicaid. I think that's right.
real quick, just to jump or to stay on that topic, I think that there was a cap or there's a percentage being charged to families, individual families or individuals for the amount of the ACA. I think I was reading something like 6.2% if they were under $88,000 for a family of four. There were different percentages, and I know, again, for those of us that make above poverty level, I guess I want to get into is I've heard stories where some of the prices of the plans have been over $1,000 a month for individual families. Is that typically the way that things are, or?
It's all over the board.
Right.
Like it used to be a year ago, we were quoting people, because of course they're still based on zip code.
Right.
And it was generally the rule of thumb, if you were inside the perimeter, the premiums were higher. If you're outside the perimeter, they were lower. Now it's all over the board. I can't give anybody a concise answer anymore. But generally, yes, the costs are a little bit higher because they're using a national average.
Okay.
And we're figuring it in so that somebody could possibly, same age, same zip code, have a premium that's lower off exchange than on exchange. But you got to remember, on exchange, and the only reason you'll go on exchange is because you qualify for a subsidy.
Okay.
Okay, because of course you have a lot more autonomy of choice off exchange. With 5 carriers we have in the state of Georgia.
And when you say off exchange, that would be what we consider in-network or out-of-network, is that correct?
Off exchange just means, right now, on exchange, you have 5 insurance companies that are on the exchange. So if you are going to get coverage on exchange through the portal, you are going to be using the 3 that have name recognition are Blue Cross and Blue Shield, Humana, and Kaiser Permanente. Okay, the other 2 carriers are predominantly then Medicaid providers. But then you go off exchange, and that's the misconception. Everybody out there has the same requirement for guarantee issue. Okay, so for example, if you go to Aetna, Aetna might have a plan cheaper for a 26-year-old off exchange than on exchange. Okay, but if somebody could qualify for a tax credit, and again, that's the misconception out there too, that people were just giving free money away. All we're doing is giving people what they would have earned if they could afford to pay for their health insurance at the end of the year, what they would get to write off in the first place.
And on that free money, all I qualify for is like $260 a year. So instead of me getting a check back at the end of the year, I told them to give it to that insurance company. So that reduced my rate by $22 like a month. So you don't have to keep the money, you give it back to pay like a benefit.
In your opinion, Latrice, this question is for you. What type of long-term effect does ACA have on mental health care?
I think it will increase access to care, and that's always a benefit. Mental health by itself has always had a stigma, but now that we have this ACA coming in and mental health is breaking down the barriers of those walls, and it's no longer becoming a stigma, where now it's becoming a holistic treatment approach. Where if you go to your primary care doctor, they may ask you some mental health questions, and they can refer you over to a clinician right there in their office. So I think it's making a lot of primary care physicians as well as behavioral health clinics look at integrated treatment approaches, where a lot of behavioral health clinics are now integrating in primary care so that they can treat a person holistically, and as well as primary care docs are seeking out counseling consultants so that they can bring in that service as well. So I think ACA is definitely increasing access to care.
And for better or worse, since we're going to provide services in the community, an integrated system is the most logical one to do. I mean, if you're going to put people out in the community anyway, blend mental health with physical health already to provide better services. It makes an intuitive leap, so why not do it?
I guess we'd like to open up the floor to any questions out there. I'm sure you guys have questions regarding ACA or the Affordable Health Care Act. Yes.
What was some mention of what coverage would look like on a bronze tier? Do you have an idea of what coverage would look like? What coverage looks like for a silver or a platinum plan as far as getting health care?
Plans that I like the most, there's a silver plan that is called a 4250/6250 plan. That one is one of the first ones on the silver plan where specialist coverage is going to be just a slightly higher copay. The problem that we have on a lot of the bronze plans is that you have your primary care doctor access for a copay, but specialists are going to be deductible piercing. So again, that puts a lot of people for anything other than I think what counts their designation. Something that's deductible piercing, and again, keeping people in the shadows on going out and getting care or pharmacy assistance that they need.
My understanding, like you just said, is that I don't have employer health care, so I got my health care through the website, and I just went to see my primary care doctor and I received the bill. So it doesn't, ACA, all plans, I have a wellness plan, that's all I can afford. Don't they all include coverage? You're not supposed to have a copay for preventative care just to go see your PCP, is that correct?
Well, correct. You got to remember that preventative care is your annual physical, or your depression screening is covered under that as well. But if you go to the doctor, let me give you some examples. Say you go to the doctor because you're going to get your annual physical. Okay, that would be covered 100%, including all lab fees or anything like that that would be associated with it. But say you go to the doctor because you have a sinus infection, or you go to the doctor and he says, I'm not really sure what's wrong with you. I want to send you down the hall and get some x-rays and lab work. Those are all deductible piercing incidents, just as they were proper.
That's what I was confused about, because I just went for a medication renewal, because I had to switch doctors, so I had to go to a new doctor, and which I wasn't happy about, but, they knew my prior medications and, whatever, were able to fill it, but I had to pay, basically I had to pay the whole bill, it was like $150, because I had a $6,300 deductible.
Correct.
So, okay, well, that's fine.
And that is the one downside on the plan that you're on, is if you do go to a specialist, that is all going to apply against your deductible. There is no specialist copay on your current plan.
Thank you.
Does anyone else have any questions? All right, with that,
I just wanted to add, as therapists, you always have your resource tool bag ready. So make sure you have information for patient navigators in your area. Make sure you have information for the website, just to direct your clients in the right area to get their questions answered. Because you may not have all the answers, so you can just refer them over to a patient navigator, and there's patient navigators strategically in every area. And then also for those clients that fall in between the cracks, that will not be able to get this insurance, and the ones that are not eligible for Medicaid, just remember that you always have services within your counties that provide services, mental health services to indigent patients. So people that do not have insurance, those services will continue.
I did have one question. How do we connect people with the navigators? Is there a website with them listed, or how does that work?
I actually brought some brochures and I'll pass them out, so you're able to access that information.
You can send them on.
One thing I want to ask about, two things. Small businesses, I'm reading that small businesses with 10 or fewer employees, with wages less than $25,000, they could opt out or something like that. They don't have to insure those employees. However, those employees will still be required to get health care through some provider, is that correct?
Actually, it's even higher right now, and of course, they've kicked the can down the road, so the misconception out there is that we're forcing companies to get coverage. First of all, it's never been on any company that has less than 50 employees. If your company has less than 50 employees, you're not required to provide any benefit at all. And out of all the companies that are currently providing coverage, especially ones under 50, okay, over 96% of them said they have zero intention on discontinuing their health insurance coverage that they're currently providing. Okay, and there's also tax credits that companies can get right now. For example, if a company has 25 employees or fewer, that meets specific criteria where their median income, employee income is $50,000 or less, they can get a big tax credit for bringing in a health plan that they provide to their employees. And then again, companies over 50 now are not having to provide coverage at all until after January 1st of 2016.
How would companies find that information? Smaller companies, where do they look for that information online?
The best place to go would be the SBA. They have very good information online.
One other point I want to bring up is that insurance companies are not allowed to discriminate based on pre-existing conditions. However, I'm reading that they are allowed to discriminate based on age. Premium rating areas, family composition, and tobacco use. So I guess just as it was before, if there's a smoker, perhaps their premiums are a little bit higher versus the non-smoker. The age of the insured, maybe premiums are a little bit higher. I'm not sure.
I don't know if I'd call it
discrimination, right? That's a regular word, right?
Because the smokers are driving. Matter of fact, one of the newest things that the ACA does provide that wasn't available before is a small employer can surcharge their employees that smoke now.
Right.
Okay, where before they were not allowed to. And of course, if you are going through healthcare.gov and you do smoke, you will have a 50% increase in premium.
15%, that's huge. Yeah, exactly. Definitely not a smoker. Wow.
What's the biggest misconception still floating out there that you'd like to address?
I think the biggest one that I'm fearful of right now is that about 80%, from Pulse is saying, of individuals out there don't realize that open enrollment closes at the end of March and they cannot get coverage. There's still a misconception that when I need health coverage, I'll just go out and I'll enroll for it. They don't realize that come March 31st, if you do not get coverage, you do not have a qualifying event, you will be in the cold until open enrollment period rolls around again in the fall, and your policy will not take effect until January 1 in 2015.
Now, I also understand that with that as well, there will be a penalty at $625 or a 2.9 or something.
Roughly $95 from those people.
$95, okay.
So not only are you going to have to pay a tax penalty, you're still going to have to come out of pocket or declare bankruptcy or go on a payment plan with the hospital if something happens.
Wow. And these are questions.
So even though the deductible is high, it's better than bankruptcy. So think about that.
Anyone else have any other questions?
I don't think I have any. Panel, you guys have been very good. Thank you. Very knowledgeable. Thank you.
Perfect time.